Welcome, everybody, and good afternoon. And I'm so excited to see everyone here. This is the National Family Support Technical Assistance Center's pre-conference training. Next steps in family peer support, tools and strategies for the workforce. I'm Gail Cormier, the project director of NASDAQ, the Family Center of Excellence. And we're proudly led by the National Federation of Families. Dr. Linda Gargan is our executive director. Dr. Gargan is also the principal investigator for NASDAQ. I want to thank you all for joining us today. Before we get to our jam-packed presentation today, I would like to go over a few housekeeping items. Today's pre-conference is being recorded. The recording, along with the presentation slides, and any additional resources shared today will be sent via email within 14 days to all who have registered. Today's agenda is in the chat. Feel free to pull it up for reference. We ask that you remain off camera unless you are speaking or to keep your microphones on mute. If you have any technical difficulties during the webinar, please type your comment in the chat box and someone will be able to assist you. Please also type your questions for the presenters in the chat box. And if we have time at the end of the presentation, we will ask as many as we can. We really hope this will be an interactive learning session today. Our day will proceed as follows. After our panel presentation, we will enter breakout groups that have been assigned. Our subject matter experts, they're our presenters, they will be the ones moving to each room. Participants will remain as a group in the assigned room. So that means everybody can stay where you are and the presenters will come to you. That'll make it easier. If you are not assigned a breakout room, don't worry, just please ask for assistance. During our roundtable family cafe style breakout discussions, we will have note takers. Note takers will be documenting questions and thoughts to be brought to the larger group when we reconvene. Questions will be answered in the reconvened large group for all to hear. During the roundtables, we'll be watching the chat and responding as time allows. There'll be a 10-minute break after the roundtable discussion. So after the roundtables, we'll take a break for 10 minutes, but we'll start promptly after that, and we'll have a big discussion about what we learned in those roundtables. Finally, after that, we will have Dr. Glenda Clare, and she'll present on best practices in our current environment. When the training ends, you'll be directed to a feedback survey. We ask that you take the time to complete the survey, which will help us continuously improve our events. It also helps fulfill our SAMHSA funding obligation to provide them with important data required by our contract. Because this is a 3-hour event, you are going to be contacted in 60 days after to complete a follow-up survey. We ask that you fill that one out too. I know surveys are a lot, but please fill out both surveys. Remember, all the information will be confidential and will respect your privacy. Please note that we do not offer CEU credits. You will receive a certificate of attendance after you fill out the survey within 14 days from this presentation. I would like to thank SAMHSA for allowing us to share this information with you today. And again, thank you for joining us. Next slide, please. Here we go. Let's kick off the training with a quick poll. So which learning objectives speak to you the most today? What do you really want to learn? A, to understand the evolving needs of families during challenging times, or B, to gain specific tools to support families in changing times? Let's pull up the poll. So it looks like to gain specific tools to support families in changing times. I think that's great. I hope that both objectives will be obtained today. I know that my objective for today is that we're all inspired. We collect a few tools we can implement in our own work, and we have some fun. So now I will turn it over to our panel members who will introduce themselves.
Hello, everyone. I look forward to this conference every single year, and it's so great to have everybody here in this virtual room, even if we can't be together in person, maybe next year. I think it's, just like, so I always come away energized. I meet new friends, and I just want to say I'm so glad to be here. I'm Lisa Lambert. I'm the executive director of the family-run organization in Massachusetts called PAL, Parent Professional Advocacy League. And we're here to talk about different trends in family peer support. And I'm going to look at it through the lens of data, which we collect we're pretty serious about collecting data. And if truth be told, I would tell you that I'm a little bit of a data walk. So next slide. So just like a lot of you, we have a call log, we have an encounter record, we have a lot of different ways that we collect data about our interactions with families. But most of the people on staff don't see the big picture, and I get to see the big picture. So when I get the data at the end of the year, I fool around with it a lot, and I try to make it speak to me so that I'll have something to say about what families are telling us through the data. And one of the things that we tracked was the call volume. Now, this is over a 2-year period. This is our fiscal year is July to June. So it's July to June ending in 2020 and then ending in 2021. The blue line are calls around mental health issues or around child welfare issues. It's everything but juvenile justice, which is the green line, which we track separately because they're separate contracts. So you'll notice that there's a big dip in about April or March of 2020 because we all went into restricted mode, right? We had a state of emergency and families just didn't call. Everybody was hunkered down. So we did what a lot of family-run organizations did. We began calling families and saying, hey, this is tough on everybody. How can I help you? But something started happening. As we were making an outreach to families that were already in our database, suddenly families started calling us, including new families started calling us. And for families whose children they'd already called about, they were often calling about siblings. And they were saying, well, I originally called you about Samuel, but boy, his sister is having a really hard time. They already knew us. We were still open for business, unlike a lot of places. And so we got a lot of calls from families. I will say, a lot of the needs of families were a lot more intense and a lot more complicated, which I'll talk about in a minute. But what I want to also note is look at the green line. What happened when we suddenly shut down kids who were involved with the juvenile justice system? They were suddenly released to home. The courts had closed. So those families were saying, now what do I do? My child's released to home. They're not enrolled in school. We have remote school. And we had a huge spike with the, problems associated with kids who were involved with the justice system. Next slide. So here you'll see we started tracking about what we always track about why families call. The blocks that are highlighted in green show an increase. And from one year to the next, we doubled in the number of calls from families. So they were finding us, which is great, but it also means there was a huge demand for this kind of support. We also tracked what had happened in terms of the ages of the children, and you can see that pretty much stayed the same. The proportion of families with younger children or teens or transition age youth, they'd stay pretty much the same. So that didn't really change over time. But the reason that they called changed a lot. We had less calls about basic needs. We had less calls about people calling because the landlord said, I'm going to kick you out because of your child's behavior. There was an eviction moratorium, right? We heard from families in our state anyway, there was increased SNAP benefits. Buses were delivering food to families. There were a lot of things like that going on. So the basic needs calls really were reduced. The school calls also went a little bit down because it was about remote school and everybody was frustrated about remote school. So I think families sort of felt like, well, I have to be patient a little bit until I can call specifically about, my child's IEP not being met. And of course, we didn't have the discipline calls. My child's getting, suspended from school because they weren't in school. So those really, went down a little bit. But what really happened, and you'll see at the bottom of the chart, is that need for community support just skyrocketed. And if you think about it, the normal way that families get support sometimes is very casual. You're standing in front of the school to pick up your child, and the parent next to you says, hey, have you heard about this great group down at the Y? Or you hear about from somebody else who you might encounter or meet somewhere else about an activity in your neighborhood, or maybe, a church is very forgiving of a child's behavior. All of that disappeared. People were not connecting to one another. So we got a lot of calls about both formal community supports, clinical supports, but also about informal supports. And that's reflected there. That just went up many, many, many times. Next slide. The other thing that was really interesting to us is we, of course, shifted, like probably a lot of you did, all of our trainings and workshops to be from in-person to online. And we did that fairly quickly. But what happened is we also revamped the topics. We had topics about families of color and mental health. We had topics about how telehealth was working for families. We had topics that were really about the times and the things that families were telling us that they were struggling with. And as a result, we really heard from a lot of families that they wanted to come into the trainings. And you have to be a family member. These are not open to clinicians. So our attendance for these monthly trainings that we hold doubled in the course of 1 year. The other thing that happened, and we didn't track this right away, you'll see the green tips on the lines, we started getting a lot of new people. So what had happened is we finally realized we had a lot of new people. So we started asking the question, please register for this workshop, and have you ever attended one of our events before? And people were saying, nope, I'm new. And that was really great to see, because we do a lot of marketing, which we'll talk about on the next slide, and we don't know if it's working or not, like many of you, and this was one way to find that out. And then the next slide. And so we wanted to figure out what made a difference. As I had said before, the demand for information, the demand for support, the demand for navigation, it just exploded. But the other thing, and I say this a lot to people in my state, decision makers and providers, parents moved online in droves. We are now being contacted by messaging on Facebook, by being tagged on social media sites, as much as we are by receiving a formal email or by receiving a formal phone call. So we moved online too. And we started being really creative about advertising things. We do a Facebook Live every Wednesday. That said, this slide says it has 500 views. We've had as many as 1,200 views every week on the Facebook Live by our staff. And our staff was really nervous about doing this, but they talk about topics that are really relevant for families, and then tell families, call us, contact us if you need some help. Our Facebook also exploded. And as I mentioned, we really, really reached a lot of new families, and we got to hear about what their demands were as well. So that's it for me. And I'm going to now turn this over to Gail.
It would help if I unmute myself. But thank you, Lisa, for passing the baton over to me. I'm so happy to talk about the advances that we made in supporting peers during COVID. My name is Gail Avent. I am the founder and director for Total Family Care Coalition. We are located in Washington, D.C., and more specifically, we are located in public housing. I believe services should be located where there is a great need. And there in Washington, D.C., there is a great need for services in public housing. Next slide, please. So one of the things that we did at Total Family Care Coalition is our service are considered portable prior to COVID, meaning that families didn't come into our office. We went to where families located. We went to schools. If we had to meet you at the corner store, at the bus stop, we met you there. But when COVID hit, things had to change within the blink of an eye. So on the, as a family-ran organization, we had to make a choice. And the choice was made not by us. It was made by the families we serve. So we stay open for business. And I'm telling you, on the day that the mayor issued the shutdown business, go on lockdown, the phone was ringing off the hook. So we got a call from this young lady that I had been working with for years. She was a young mom, new mom. She's in her 20s, and she had a baby. The baby was 3 months old, and she had mental health issues. I've been working with her since she was a teenager. So she was feeling a lot of anxiety. And that was another reason why we want to stay open. But she had said to me, Miss Avent, I don't know what's going on, but it's very difficult for me. I'm a young mom. I need help. I'm not able to get my family to come over because she was in isolation. And she admitted she needed help with a newborn baby. And out of the blue, she said something that totally shocked me. She said that she was thinking about committing suicide. And not only was she going to kill herself or thinking about killing herself, she wanted to also kill her baby because she didn't know who would be there to take care of her child. And she wanted that child to be taken care of. I said, look, that's not an option. We're not going to do that. We're going to work through this together, and I'm here for you. So we immediately started hearing from other families who needed help too. So for my staff, I had to get together with my staff for us to determine how can we retrain ourselves and in the midst of trying to provide services also. So we was in-person services. So we made that transition to have virtual recovery support service, family support services, youth support services, virtually. I'm old school. It took me a minute to get acclimated to Zoom, but we did it. And we stayed open. So then we began to explore strategies to help family address their needs. So we looked at the top 3 that was reoccurring, was being requested the most. So that was food insecurity and resources to stay connected to family members and how to support families as they enter a new way of life. So we began to devise the strategy of identify how can we address these needs, because as we know, when you're dealing with families who have mental health and children have mental health, it's hard to focus on a lot of stuff. So we try to focus on take something off of their plate so that we can reinforce and re-engage them in being consistent in their mental health needs. So we learn strategies to help family during COVID and beyond, because now we know there's a new way of life. You can't have one size fit all. We had to do a hybrid, which is in-person services and virtual services. So we looked at community partners and larger organizations to assist us. They had resources. We sent out the battle cry. We got a lot of supplies in, cleaning supplies, gloves, masks, hand sanitizer, everything. We are spending hours on our warm line so that we can have more staff working from home to take in those calls, to have a conversation with those who felt like they was isolated, because emotional support is very important during these times. And for our staff, we develop our own COVID-19 protocol, and we adhere to them. Next slide. Food insecurity, even though people got increase in SNAP benefits, they couldn't get to the store. There was restriction on getting to the store. So what did we do? We heard from parents that children was hungry. So we contacted the USDA, they had emergency food distribution program. And we applied and became emergency food distribution site. And under this program, we was feeding children from age 3 to 18. And the food was non-perishable. There was 7-day meal plans, and you had 7 breakfasts, 7 lunches, 7 suppers, and 7 snacks. So believe me, that's a lot of food because that's for one individual. So if you got 3 kids, imagine we was putting out a lot of food. We bagged the food up and opened the gate and put the bag out so we could safely transfer the food. But we saw something also. We saw little kids showing up by themselves saying that they was hungry. So the food consists of non-perishable food, which was like packaged cheese, crackers, cereal, and they also had fresh fruits, apples, pears, and oranges. And during the height of the COVID period, and all the way up until I said February this year, we served over 100,000 meals. And the parents were grateful. They didn't have to prepare the meals. It was easy and convenient. There was no cooking. Children could select the meal they wanted, their choice. And it was, and the children saw it as, I don't have to worry with mama when she's doing something else. I don't have to bother my parents. Even if I'm doing online schooling, I can grab a meal and mom can continue to support me with my homework. Next slide. So another need we saw was communication technology, of course. So the need was how to provide parents and seniors with communication tools. So again, we reached out to our community partners. The parents needed tablets to help with the children online schooling. If they didn't have computers, seniors, we helped get them refurbished cell phones, taught them how to use Zoom. Well, be honest, my staff, because like I say, they was feeling isolated and detached from their family. Family couldn't come to see them. And then the seniors really learned some new skills, and that's using how to use that virtual platform to stay connected to their family members. In our office, since we had internet, we invited, we had 2 sections. So the families could come in and use one section of the office to connect to the internet so they can help the children keep abreast of the online schooling. And we found some virtual homework assistant for those children so that they could feel as normal under the condition as possible. Next slide. Then we say, well, we had to keep this up because life is not going to change, and this is a new way of life. So what did we do? We said we're going to help parents learn how to ask questions about children returning to school because, you know, it seemed to be the #1 priority to make sure children return to school in person because research has shown that during the time children was online schooling, the academic deteriorated. So the priority was get them back in school. So we started communicating with teachers and school officials to say, once these children come back into school, give them a little grace because it's been very challenging at home. They're going to need help in transitioning from home to school. We also encourage them to form a relationship with the parents, how wonderful it can be for the parents to still feel useful, even though the children is not in the home. And then we also help parents understand what are the school COVID-19 protocols. You know, most of the time around here in DC, the children had to be dropped at the front door. They can't come into the school. That was a little troublesome for some of the parents. They couldn't understand why I can't go in there. But we encourage them to understand it's for their safety and the safety of their children. And we also encourage them to use the internet to communicate to the school, call them on the phone, and have outdoor sessions. And we wanted to help parents understand how to safely quarantine siblings. You know, a lot of families have more than one child going to school. So one school may have positive contact and then the other child may not. So what you do? So we help the parent understand how to adhere to the quarantine protocol so that their child could go back into the home, into the school. Then we looked at, we have to help these parents with mental health needs too, because even though the parent had some, I'm gonna tell you, it was hard for everybody. And everybody was feeling anxiety, everybody was feeling overwhelmed, not knowing what the future could hold. So we began to talk to families and talk them through anxiety and encourage them to venture out into the outdoors, because as the city began to lift restriction, you could go back into community, kids would get fresh air. Think about kids being at home and not being able to see their friends or going out into the open because they didn't know what was going to, how COVID was going to affect them. So we help parents understand how to do that safely, how to do that in increment. Take your time. It's not a rush. And then we encourage parents to access the school mental health services for their children. DC began to improve and have a robust school mental health program. So we wanted parents to understand, talk to the officials in school, your teachers, and if there is a concern with your child, have that conversation, and also maybe even ask, what are your school mental health services available, not only for the child, but for their parent, because you can't do one without the other, and parents always want to support their children's education, and children really are the center of education when it comes to parents and those school officials. So we wanted them to feel well supported. And I also wanted to remember, I have a staff. I need to take care of my staff too. So I encourage my staff to have self-care plans for themselves. So thank you for allowing me to share. So I'm going to pass it on to Nelson.
Thank you, Gail. My name's Nelson Rascone. I'm the executive director of Dad's Move out here in Washington State. We were formed 10 years ago by 6 fathers who all had children with behavioral health needs. So we strive to get more father involvement in the family and also in our system. So next slide. So a lot of our longtime challenges that we've had over the last 10 years really came to light during COVID. One being, we've often had a challenge reaching diverse fathers of color. And this became even more challenging when we had to do events virtually. We found that a lot of dads were especially initially turned off by doing these events in person. They wanted that physical connection. So we've really had to kind of relearn what we're doing, which I'll talk about in a minute. But historically in Washington, over half of the parents who have children with behavioral health needs are moms, which was, one of the big reasons we were formed. We seek to change that. And unfortunately, of the fathers, most are Caucasian. So this has been again, a long time challenge that has been exacerbated by the pandemic, not being able to do in-person events. So, like I said, over the last 2 years, we've really had to rethink how we do things. We have made efforts to make partnerships with new groups, new organizations. We've put a lot of effort into making partnerships with tribes. We currently are forming a strong partnership with the Coalville Tribe, which is in rural north central Washington. in our state's largest geographic county, where there's a total lack of services, and just like a lot of the state has a lack of father involvement. So we're going to be doing in partnership trainings, both in person and hybrid, in the next year or two. We have also been meeting with organizations that serve African-American fathers and Hispanic fathers, and forming partnerships with them in an effort to change this. Next slide. So, interestingly enough, we also saw opportunities come up during the last 2 years. You know, before the pandemic, we hosted 2 in-person father support groups. So we had to shift in the pandemic to doing one virtually, which, you know, had its challenge from the standpoint that we started seeing, you know, participation die off after a while, because we think people got Zoom fatigue, like a lot of people. But we also saw an interesting shift. We saw men joining us from all over the world, literally. We had guys from Germany, Israel, South America, South Africa, Boston one time join our meetings, and we also started seeing more diversity. And our theory is, as the pandemic went on, especially with having to deal with schools, more men were kind of forced to have to seek out additional help. We also saw phone calls dramatically increase from men. So I'd say overall, while we've had challenges in the pandemic, we've learned a lot of valuable lessons and learned how to do things differently. As a result, we are already starting the process of doing hybrid learning. We had our first in-person event in October, which was a father's camp out, which was the first time we ever did an event where fathers and their kids could come. And then over the next several months, we're going to start doing our support groups in person again, with a virtual option. We actually just started that last night. We, a group that we collaborate with in Southwest Washington, that works with moms. We are working with them to do a hybrid group with that. Next slide. So like a lot of organizations, one of the biggest things that we saw was parents having a challenge with the schools. And interestingly enough, during this time, we saw a lot more fathers reaching out for help. And again, our thought is that because of parents having to work from home and also initially having to help teach their children at home, fathers had to step up out of necessity. And we saw a dramatic increase in calls from fathers looking for guidance and help, looking for education on school-related issues. I actually just fielded a call yesterday from a father who is looking for guidance on how to work with the schools and also how to navigate our mental health system. Children that are on IEPs, huge challenge with the online learning and not getting the supports they needed. We heard a lot about that. And again, we saw a lot of men were kind of having to start stepping in and help support that where they haven't had to before, because moms would go and deal with the IEPs. So that was kind of exciting for us. We saw that shift and we hope to continue it. Financial hardship. We definitely saw this. There was a huge financial hardship with parents, especially with some who could not that could not go to work. We saw parents, not being able to pay their bills, not be able to support their families. So this was a big problem that we gave a lot of parents resources for. Next slide. Actually, back to you, Gail.
Wow, we've really had some challenges and exciting opportunities in the last 18 to 20 months. This was very interesting. Do we have any questions for our three panelists? You can type your question in the chat. I can wait. I found that for me, Gail, the work you're doing is so needed and in such the right place in housing. That is wonderful. And Lisa, I love that you're a data geek. You're the one that fills in when I need that information. So I do appreciate it. I also think Nelson, having dads grow like that and really have that opportunity to have people all over the country join you. What an opportunity. Some of the things that have happened and the changes that have happened over the last few months have not all been bad. So I appreciate that. I have questions coming up. Has anyone had experience with a mom leading a dad's group? Oh, that might be one for you, Nelson.
Yes. And that's something I actually failed to mention. We do work with moms. We actually get a lot of moms that reach out to us trying to learn how they can get their significant other more involved. Interestingly enough, we have a mom in Southwest Washington who has led a group. Interestingly enough, we had her connect with our group from her significant other, and they're now divorced. But she has led a group, and she does a lot of teaching for us with other moms on how they can better engage their partners.
And Nelson, another question came up, and I think you mentioned it, but I'm just going to ask again. Will Dad's Move still offer virtual sessions and groups from any state? Can anyone come in even after the pandemic? Or
Absolutely. We're actually hoping to use the experience in the pandemic and the virtual world as a springboard to move beyond Washington.
That's really interesting. And I think Elizabeth asked, I would like to know about whether other organizations are interested in learning from your positive experiences. And not only the positive experiences you had, Nelson, but how did you get the international group in?
Well, to be honest, I leveraged the fact that I actually come from a diverse background and have family in 15 countries. My father immigrated here from Cuba, and my mother immigrated here from Germany. And on my German side, I had family literally immigrate across the globe. So I've also personally visited a lot of that family, well, before the pandemic. And I actually have two cousins who are special ed teachers. So I've leveraged those connections and advertised to them.
Wow, that's pretty interesting. Do we have one final question for any of the three panelists before we move on?
Can I ask a question of Nelson?
Absolutely.
Nelson, for the support groups that you offer, are dads from other states able to participate in your virtual support group?
Yes.
Okay.
And it was an accident, you know, like everyone else. We've had to learn when we had to shift to Zoom. You know, suddenly we're realizing, wait a minute, we got people joining us from all over the place because they can, and we're like, sure, why not? So we'll continue that. I don't see any reason. I mean, dads need support everywhere and encouragement everywhere, not just Washington. That just happens to be where we live and where we started.
Well, I can't tell you how excited I am to hear that. We're definitely going to use you as a resource and refer our dads to you because they need all the help they can get, and there's not nearly enough programs out there for them.
No, not at all. I will tell you, I know that from personal experience. I spent 5 years as a single father, so it's tough.
And I just from personal experience running NAFSTAP, we get a lot of dads who call and say they don't have anywhere to go to. So it's very good to hear this, Nelson. Do we have any last question for either Gail or Lisa before we move on? Okay, now I'm going to ask a favor of everyone. Please be patient with us as we do our breakout groups. This is going to be meant to be like a family cafe where we learn 4 different tools. So we're going to have everybody almost automatically broken into groups, but if you're not, be patient and we'll help you as soon as we can. Participants will be divided into the 4 group family cafe style rotations. Participants will remain together. Subject matter experts and note takers will change rooms. So your job is easy. Just stay together and we'll move. Each group will have 15 minutes to hear about a topic. Each topic will provide 1 tool for you to implement in your own work. And keep your eyes out for that 1 tool because I want you by the end of today to at least have 4 tools. So at this point, I would love to recap what we missed. And I know that some people missed Gina's piece first. So I would love it if Gina, can you just go over the tool for 1 minute? And I know several people have a couple of questions.
Quickly, I'm Gina Fitzgerald. I'm with SAFE Project, and I lead family outreach and support there. 2 years ago, we joined with Partnership to End Addiction, formerly known as Partnership for Drug-Free Kids, to build a family support locator. Unbelievably, there is no national database of family support groups across the country. So we decided to build it ourselves. Actually, our founders decided we would build it ourselves. So that started 2 years of searching online. I wanted to have a minimum of 2 groups per state. And at this point, we hope to be launching in another week or 2. I'm sorry we weren't live for today. But you can get a sense of what we're going to have on that locator if you want to go to, and I'll add all this in the Q&A section on Whova. It's safelocator.org, and that will become the Safe Family and Treatment Locator. You will be able to go in if you're searching for, and thank you, Michelle. Michelle's putting a lot of information in the notes right now. You will be able to go in and either start with looking for treatment and then be directed to find information about family support in the same geographic area where you're searching, or you can also go in and just simply look for family support resources. And then at the end of that, you have the choice to look for treatment support as well. Now, while this is designed for families to search, we also believe that this would be a valuable tool for people such as you that are working with families in and out every day. We've collected about 700 resources right now of organizations across the country. It goes from grassroots to state, local, nonprofits. If you go onto the documents section in Whova, I did create a handout where you can look at it and get a sense of the 17 categories that we have. And within those 17 categories of the type of help that's available, there are another 100 categories under that. And just to be able to tell you that there's 17 categories and 100 different options It's just amazing because that means that there's a really rich resource of help out there for families that we want people to know about. So, you know, if somebody's looking for faith-based, whether that be Christian, Buddhist, tribal, they can find it on there. So
Well,
this is,
thank you.
yeah.
Thank you, Gina. And we had one quick question as a follow-up about the locator. Liz Sweet wanted to know if the locator identifies certifying entities.
Yes, it does. There is a section in there for certification where you can select, I won't go through them all because there's about a dozen of them, but you can find out the licenses, certifications, and accreditations for each group. But it has to be, they have to be able to enter it.
Well, thank you, Gina. I appreciate that. And yes, everybody will have access to all of these slides. And if in the chat, there are a couple of handouts, if you wanted to open them up and pull them out and print them up, that's great. You will also get them when you get your certificate of attendance. So I'd like to ask our note takers to come on camera and kind of talk about their thoughts. And I would love it if we started with Alex and Pat. And Pat, feel free to jump in to have a little discussion. But can you give us a quick recap of what stood out? And if anyone has any questions, now's the time to ask them. Pat and Alex?
Hi, everyone. Yeah, I'm happy to share some takeaways from our group. So there was just generally an appreciation for the discussion around some of these concrete tools that Pat discussed. So those included some different ways to process and respond to the same situation. Sometimes we call that reframe. Some tips on how to validate and just really focus on listening to others. Challenging unhelpful thinking. So starting with really stepping back, identifying the emotion, helping folks identify their support system, who it might be most helpful to turn to in that situation. And then also focusing on just staying in the present as opposed to jumping towards the future and worrying towards the future. And then the last tangible tool was just going through a breathing exercise, 4-square breathing, which I'm sure many of us have done before, but just the power of that tool. And so diving into some of these a little more, there was talk about just the importance of the validation piece when working with families. Folks were sharing that a lot of times parents might repeat their story more than once. It could be the first time that they're ever sharing their story and really just being listened to. And that just points to the importance of validating and listening and really fighting that urge to jump right into problem solving, which I think most of us just instinctively go to. So really fighting that and taking a step back and just listening, accepting what they're saying doesn't mean you agree, but just the importance of validation.
They can bring up Molly and Lachelle. That would be great. And Lachelle, what do you have?
So we had a really great discussion around collective trauma. And a lot of it, I'll just kind of go over some of the things that we discussed. Talked about resiliency is ordinary for us in general, but we have to remind ourselves that we have it. Molly talked a lot about that, you know, resiliency is like a muscle and you exercise it and it gets stronger. We talked about the 4 C's, which was her tool that she presented to us. And some of the comments was that, you know, it was a great tool because it gives you ideas of what works and how it's right there in front of you to think about these 4 S's. And we'll talk about those probably later with the tools. They also talked about, you know, parenting is hard. And a lot of times, you know, just because you have a child that needs extra attention, you parent harder, and that's okay because you're building your strength. We talked about self-care versus collective care. And the idea of collective care is, you know, it's just a really great concept to use, not just with our families and coworkers, but just with us as being human beings, you know, showing collective care because we've all been through a level of trauma, for lack of a better term, through this pandemic. And then also I'll end it with saying that, you know, how can we take on the perception that being hopeful, it can be contagious. So all of us can be hopeful, regardless of what our situations are, that there can be, or there is a light at the end of the tunnel.
Well, thank you, Lachelle. Being helpful can be contagious. That's what Corey Hopper has said. And I agree, Corey. Well, lastly, it's Tony and myself. And Tony and I talked about really, we had a very, very vibrant conversation in our rooms, albeit sometimes quick because we only had 15 minutes each. But some of the things that were very interesting was really to challenge your own belief system, that churches need to be inclusive. One thing that I heard that was really interesting when we talked about religious and cultural beliefs was that one participant said, God can move mountains, but he expects us to bring the shovels. I thought that was great. We talked about social media and how that can impact our mental health and the mental health on not only us, but the folks we're supporting, the families and the children. The tool, though, was very, very important, and that's preparation, plan ahead. And Tony was very good at explaining that. Tony, anything else? You're on mute.
Yeah, I think you hit it right there pretty accurately there. Planning ahead and being flexible, because no matter how much you plan for, something always comes up, and you'll be able to maneuver around that. And just being engaged with your families and being culturally aware of what their belief system is to be able to better address their needs.
Thank you. Do we have any questions for Tony or myself? Bonnie says sometimes people need someone to listen without trying to fix. Absolutely. And that is a very important piece of family peer support too, Bonnie. And Diane, thank you. Excellent presentation. Well done. I appreciate that. Well, don't go anywhere because we have more to come. If we have the next slide. So let's go to a poll question. This is one of my favorite poll questions. Which of the 4 tools that you heard in the different rooms, which of the 4 tools do you think you will use the most? A, breath work. Well, 1, breath work. 2, the 4 S's. 3, plan ahead. 4, family support, safe locator. And if we can pull up the poll, please. All right, let's see what the results are. Let's see, just by a smidge. I think it's number 2, but I'm not really sure. It could be number 3. Oh, I mean, could be number 4. So I'm glad. I hope you will be able to use some of these tools and make them useful in your own work and in your own life. And now I would like to go on to introduce Dr. Glenda Clare. She will be talking about best practices.
Well, I think we've heard a lot of good practices just a few minutes ago. Can everybody hear me? I'm not sure if you can or not.
You are perfect, Glenda.
Great.
Yes.
Well, no, I'm not perfect, but okay. I actually chose all of the above in the last poll because that is what I believe. I believe all of those are great. This next section that is dealing with best practices in our new world is divided into 2 sections. The first one is about incorporating best practices. So if you go to that slide, and then the second part is about approaches for reaching individuals and families. So we're going to stay here on this slide, and I will kind of give you what my concept is. I am basically focusing on digital and hybrid practices, and that is because in this new world, we've had to make some adjustments. So the first thing I want you to think about in this brand new world, new in many ways. We are doing things now in a different way. We hadn't been as digital as we currently are. So the first thing I want you to think about is focusing on the here and the now. And that means that we start by having a real discussion with our individuals and families about what is going on. How do they feel about this new digital world? One of the things that I have found is that people usually go on my energy. If I feel negative about this new thing, they're more likely going to feel negative too. But if I'm positive and I talk about the possibilities of using this technology, be it just being digital or hybrid, then my clients, my individuals and families are more likely to follow along with me. Now, I personally see lots of possibilities in terms of using this digital technology because it allows us to do so many things that we were not able to do before. Number one, this is a thing that I know that I have found many times with individuals and their families. They couldn't come to a session. They couldn't come to a session because different things were going on with the children, or, the transportation was out or whatever. They don't have to worry about that. They don't have to worry about whether or not they don't have enough money for car fare, or if the car is broke down, or whatever is going on with gas, or whether or not there was an accident down the road. They don't have to worry about any of that. They can meet with me on their terms. Either they've got a computer or they've got some kind of cell phone. As long as it has a camera and the capacity to speak, we can meet. They can be walking in the park. Now, if they are walking in the park, or there's somewhere where other people are, we are going to want to let them know that, confidentiality is important. So watch your space. If somebody's in close range, you don't want them to be a part of our conversation. So remove yourself. However, it does make it possible for them to meet us wherever they are. And so when I bring up that possibility, people say, that might be a good thing. Take that into consideration. Another thing that I know that interferes, keeping us now in the here and now, is that people are sometimes not willing to do this because they're scared. They don't know how to use all of this technology. And you know what that means? It's a new opportunity as well. It's the opportunity for you to teach them how to use the technology. It might even be a good opportunity for them to see the strengths of the young people in their lives who may already know how to do this. Anyway, focusing on the here and now, let's listen to them. Let's hear what they've got to say in terms of being digital, doing hybrid. No, we don't have to be digital all of the time. We can mix it up, but have an opportunity to talk to one another, to talk about the pros and cons, teach when there is a need for teaching, and then take it from there. Okay, so we have decided that we are going to be digital. Now, what I've noticed is that most people are actually using Zoom or MS Teams. Wait a minute, it says very important to meet people where they are. You're right, Bonnie, very important. That is like the most important thing. But many people now are using Zoom or Microsoft Teams. Those are the two that I've heard most people use. And they're usually using that because they're not as expensive. Some of these things can get kind of pricey, but those two, I think, have a free version, and so it makes it better. What do we need to know about that? My tip number 2 under incorporating best practices. You've got to identify the software that you want to use. You need to know, identify, know, and then use effectively. So identify what software you're going to use that is also going to be user-friendly for your individuals and families. Then you've got to learn that software, because what's the point of saying we're going to use this software if you don't really know how to use it? You need to spend some time learning about that, and then you need to use it effectively. Now, I'm going to get into more of that on Friday. Just so you know, I've got a workshop on Friday called Reaching Families During the Digital Age, but I'm giving you a little tidbit right now. So you need to do that. What you're going to want to do is you need to make sure that you know what is available, what software is available. Is it going to be cost effective for your agency to use it? I'm reading my notes. What can your clients actually use with the resources that they have? Now, I just saw Carl just wrote a note I'm trying to read. I had to drop out of outpatient twice before, well, your note went. I had to, Gail, can you what he just said?
I can, and it's from Carla. She says, I had to drop out of outpatient twice before able to complete the third time because of transportation, and I begged my treatment center to video call on Messenger. So, Carla
this is a
talking about
useful
how
device.
helpful.
That's what Carla is basically saying. This is useful if we use it. It's maybe not good for everybody, but it can be useful for a great many people. So I was going down my list. I keep seeing, chats coming up, so I have to go and look every
I'll
once in a
help
while,
you
'cause
with
they
that.
might say something. You'll help. Gail's going to help me with that. Okay. So I was telling you what is available, what is cost effective, what can your clients actually use. Then once you decide to use it, prepare ahead of time for how you're going to use the software, the device at your particular session. And then my last section. So as you can see, I'm not really as much into PowerPoint. You know how they say death by PowerPoint? There is death by PowerPoint. Overuse of PowerPoint is not a good thing. Actually, overuse of PowerPoint sometimes reduces communication discussion. So if we were in a traditional group, I would be making you all speak to me. I'm not including you in discussion right now. I will on Friday. I'm not including you in discussion right now because I've got a short amount of time. However, I am engaging you. I am not having you read everything. And so you are paying more attention to me. Okay, talking about engagement. You want to create an engaging presence. So let me show you a cheat sheet that I have. I'm not using it right now, but you might want to use this. This is a clip that I put on right over the eye of my camera, so I know where to look. So I'm not looking over here, and I'm not looking over there, but I am looking directly at the individual and the family that I'm speaking with. And what do we know about that? We know that looking at a person creates engagement. They feel like you're paying attention to me. And so that's what I want to do. Another source of engagement, because I read a couple of y'all said, I like her. Yes, because I'm a little bit animated. I am talking to you. I am talking to you with passion about whatever I'm talking about. I'm not saying, yeah, that's what we're talking about today in a monotone voice. That's boring. I don't want to talk to anybody that's boring. You don't either. Your clients don't either. And so we've got to be engaging. We've got to have an engaging presence when we are communicating with the individuals and families with whom we are working. Fourth point in my incorporating best practices. Let's get into some activities. Now, what can we do to engage our clients? Well, if we look at Google, which is a free resource, you don't have to pay anything for it, you've got Jamboard. On the Jamboard, you can interact with the client and have them post things and do different things. Actually, if I'm really thinking about it, you don't even have to go to Jamboard to do that. You can do that right on Zoom. Now, I don't know what the possibilities are, Ms. Freeman. Am I able to share my screen? That means you have to tell me yes or no.
I'm sorry, I'm just trying to get off of mute. Yes, you can share your screen.
Okay, see, you was on mute. Okay, that's okay. So I'm going to share my screen. This will stop other screen sharing. Okay, it will stop. So I'm going here to the whiteboard. Are y'all familiar with the whiteboard? If you're familiar with the whiteboard, raise your hand or do something. I see Nelson. Nelson is saying, yeah, there you go. Who just put that Y up there? Who just wrote yes? So we can do things. We can ask our clients questions. We can have them draw things. We can do all kinds of things just using the whiteboard. What we do is we want to engage the people that we're working with in the work that we're doing. So I'm going to stop sharing this. And I want you to think about some other things that we can do to engage. You saw earlier that there were polls. You can use the polls, but here's what I really like. I like using video. So I was trained. I'm Dr. Claire. I was trained as a therapist. One of the things I love is I like bibliotherapy and I like cinema therapy. And so I can use video clips that we can watch together and all kinds of things. Everybody knows that there are always YouTube videos that are 3 minutes, 4 minutes, 5 minutes, 10 minutes. You can use a small clip of something and then have a discussion. I liked that. I think it was Gina. I think that was her name. She just showed us the safe locator. Well, she was telling us it's coming out, but those kind of locators. So here's what I know. One of the things that I can do is walk through those locators with my individual or family right there. One of the things that I learned a long time ago was that in terms of case management, I need to refer my individual or family to someone else. I need to introduce them to that person ahead of time. Guess what? I can invite that person onto a Zoom call and introduce them right then and there. See, those are just some basic things that you can do to get that engagement, to engage your audience. Okay, so now, Ms. Freeman, we're gonna go to part 2. How are we doing with our time?
We have 6 minutes.
Oh, 6 minutes. Oh my goodness, I gotta rush. Okay, it's okay. It's okay. So you're going to the next slide, which is about reaching individuals and families. Then, yeah, that's the one. So strategies to reach individuals and their families. So I am one of those people who came up doing a lot of outreach. My background is public health and behavioral health. For the most part, I've always seen myself as a health professional because I started off as a community health educator, going out into the community, teaching about HIV, teaching about sexual practices, got back in, learned more about behavioral health practices. And how to get people in treatment and what have you. Addiction had always been one of my focus. But what I learned is that I needed to find community gatekeepers so that I could reach the population that I wanted to reach. So who are those populations that you want to reach? And who might be able to help you get in contact with them? Well, one of the things that I know is that the faith-based community is in contact with all different kinds of people. Now, you can't be narrow-minded and just look at one group. You might want to look at Christians, Muslims, Jewish people, Buddhists. You've got to find out who might be in contact with the people that you want to know. There is a hot dog stand at the bus stop here in Durham County. But I don't know if I should call it a bus stop. It's a bus terminal in Durham County where all of the buses come. Do you think that that hot dog man knows who some of the people are that I might want to be in contact with? Of course, because they all go and get hot dogs from him. So you've got your religious leaders that give the information. You've got gatekeepers, people that people come in contact with all of the time. The bus drivers, they also come in contact with folks. People in schools, the school counselor, the school social worker. Even better yet, that receptionist that keeps attendance and everybody has to walk past her or him when they come into the school. They know everybody. So in terms of reaching your audiences, you got to know who the gatekeepers are, and then you've got to engage them. So how do you engage them? Well, you got to engage them by being real. One of the things that I know is that I use my lived experience. So you all will find out in another workshop that I have on Saturday. Yes, I had 2 other workshops. You will learn that I have been the head of a grand family. Grand family being a grandparent or other family member raising a relative's child. I have lived experience. I know that when I share my lived experience and I'm real with people and I talk to them so that they can tell that I kind of understand what may be going on with them and am willing to share what I've learned with them, that's engagement. Also, in terms of engagement, it's important for people to know that you care and for you to treat them well. Don't treat anybody in a way that you don't want to be treated. Don't talk down to people. Ask them what they want and help them to achieve the things that they want. And finally, there's nothing like incentives. So different organizations have different philosophies in terms of incentives. Some will give cash money. I'm gonna be honest with you. I'm a licensed clinical addiction specialist. I've worked with a lot of people that are addicted. I'm not big on giving money. I am okay with giving gift certificates. I am willing to give prizes or what have you. I'm kind of turned off with the money piece, and that is because I've seen clients that I know use the money and then go get high, and I can't reinforce that. But that is for you and your organization to determine. And finally, I forgot another final. You can get experts to come and share with your individuals and families. So just like we're having this conference now, this is a big thing, but it doesn't have to be big. You can have a small webinar using Zoom. I think Zoom will let you have they'll let you have close to 100 people for free for 45 minutes. You could get someone with lived experience or some expert in the area to give a presentation to your group. If you did just 30 minutes with 15 minutes question and answer, you got a great presentation. You can invite different churches. Maybe they might have something where people can congregate at their church or mosque or synagogue. I know just last weekend, I went to a wonderful outdoor church service, and they had a screen that I could look at and everybody else could look at. We could be 6 foot distance and enjoy the presentation. So think about those things in terms of our new world and how you can engage clients and be present for them. Thank you.
Oh, Glenda, that was wonderful.
That was
Thank
great.
you, Glenda. Do we have
Thank
any?
you.
We have a couple of minutes to ask Glenda any question that we would like. Do we have any questions for Glenda? And you can put your mics on and just ask.
Ask one
They're
question.
not going to ask now
that I
because they
have.
are
wait,
coming to
wait,
the
there is one.
presentation. They come into the presentation on Friday and Saturday.
Go ahead, please.
Okay, I guess one of the questions I have is, I know you mentioned, definitely not doing the money thing. And I'm 100% in agreement with that. What about one of the things that our organization is looking at doing is gift certificates to locally owned businesses where the family can go, like if it's a locally owned restaurant, the family can go eat. It supports the family with their goals, but at the same time, it also supports the locally owned business instead of some big national chain business.
I like that. I really like that. I hadn't thought of that one. That's a good one. Because you're supporting your community and you're supporting the families. I like that.
Any other thoughts?
Thank you, Glenda.
Linda.
Thank
Glenda,
you.
I have a question. Linda,
There's a question?
Yeah, what were the two names of the sessions you were going to be presenting?
So I know that I'm doing one on Saturday dealing with the grand family workforce. And then the second one, I wrote down the name, is the one on Friday is reaching families during the digital age.
Okay, thank you.
And both presentations are geared as an extension of what we just heard from Glenda. And on that note too, a lot of our presenters are presenting all week. So if you see others, I know that Nelson is presenting and there's several others. So we were very fortunate. This is a free pre-conference event, so you don't have to register for the conference. But if you're registered for the conference, you can hear many of our presenters in the next couple of days. And I think we're going to have a great conference too. Glenda, thank you for joining us. And I really appreciate it. I also want to thank
Glenda, for your energy and passion.
Thank you.
Thank you, Glenda, for your exceptional presentation. Well done. I hope I can meet you in person someday, really.
That sounds nice.
I want to know if you sell that enthusiasm by the bottle over the internet.
Right.
I would buy it.
Thank you, everyone. And I want to thank all our presenters today. And thank you for your participation. I hope you all enjoyed this and got some rich tools and energy and information. Special thanks to our NASTAC staff. Now, we do have a request for you. I mentioned at the beginning of this event that you'd be directed to a feedback survey upon exiting this meeting. So please, please fill out that survey. I really appreciate it. And also, when you fill out that survey, because this was a 3-hour event, SAMHSA would like us to do a follow-up. So in about 60 days, you'll get another email with an added piece of a survey, and I would love it if you could fill those out too. I hope you have a great rest of the day. And if you go into the conference, enjoy. This is one of my favorite conferences.